of GERD is, like I said, GERD is a lifestyle disease. So the first step of the treatment is a lot of lifestyle modifications. There's a wide list of food to be avoided for GERD. Alcohol versus GERD, smoking versus GERD, deep fried oily foods versus GERD, and like I said, binge eating, skipping a meal and then having a very heavy meal versus GERD. Certain types of foods versus GERD. So deep fried oily foods versus GERD, coffee, tea versus GERD, citrus juices, your orange juice, lemon juice, they versus GERD, chocolates versus GERD. And the kind of lifestyle precautions which we tell the patients with this is stay away from alcohol, stay away from smoking, have small frequent meals. Break your food into, in fact, not more than 3 meals a day. Make it 5 meals a day: breakfast, brunch, lunch, evening snack, dinner, and so forth. And every time, don't fill up, eat till you're filled. Get up from the table when you're hungry. If you feel hungry again, have another meal in a couple of hours. And as the day goes on, your breakfast should be a bit heavy, but as the brunch, lunch, evening snack, it should get lighter and lighter. And always eat your dinner a couple of hours before going to bed. Then avoid wearing, patients with GERD should avoid wearing tight clothing. If your waist is 34, don't try to fit into your old 32 pants. When you fit into tight clothing, it worsens reflux. And weight gain is it's an issue. So patients who have a lot of weight, it increases the intra-abdominal pressure and worsens the reflux. So you need to lose weight. Of course, other than these measures, the main treatment of GERD in terms of medication is the PPIs. PPIs are the proton pump inhibitors which reduce the acid secretion in the stomach. So we have medicines like rabiprazole, pantoprazole, esomeprazole, ilaprazole, lansoprazole, which actually reduce the acid secretion and give very good symptom relief for some of these patients. But as you realize, these inhibit only the acid secretion and decrease only the acid component of the reflux. So you can have good relief with PPI, but your bile reflux, food reflux, and the air reflux, which reflux as belching, these things can persist even after PPI. Another concern which we have is the patients who are on PPI, they keep taking long-term PPI. That means keep taking the antacids and medicines for years together. Now there is evidence to show that taking PPI for long period affects has many side effects in terms of increased incidence of Alzheimer's, kidney disease, bone disease, cardiac disease, as well as increased incidence of gastric tumors. So a lot of patients, they say we are taking gas bindle, gas tablets, which they keep on taking for years together. This is supposed to be avoided. And if you're having persistent reflux symptoms after stopping the PPI, you need to meet a doctor.